Now, in the first 100 days of this administration, I would suggest that President Obama has actually done more to advance the goal of health reform than has happened in the last decade. And I just want to remind you of the first couple of things he did. And not only did the President talk about this actively during the course of the campaign, making it clear that this was his top priority, but when he got to office, the economic situation had changed somewhat, in case you hadn't noticed. And people kept saying, well, doesn't that put off? You know, we've got to put health reform and climate change initiatives further back in the agenda because we've got to work on the economy. And he has said clearly over and over again, you can't fix the economy without fixing health care. It must be done. It must be done this year. So one of the first bills he signed was the expansion of children's health insurance. 4 million more American children will have access to health care, and that's very good news. Then the Recovery Act came along, and in the Recovery Act are some significant investments in initiatives that are directed toward the workforce for health providers. There's about $500 million to address the looming workforce shortage of nurses and doctors, knowing that if more people are going to have coverage, we absolutely need more health providers in the pipeline. So not only additional slots for nursing students, but additional incentives for nursing teachers. One of the things that I learned in Kansas is it's great to have student slots, but if you don't have teachers to run those courses, it doesn't do you a lot of good. So while states have been investing in healthcare workforce, there's been very little effort at the federal level up to now, and this is a step in the right direction. 14,000 more students will be able to be trained for nursing careers. And what we know is that those two steps help to set the groundwork. The other thing that happened in the Recovery Act is that tried to make sure that Americans who currently have health insurance are able to stabilize it a bit even in these precarious times. So help for folks who got laid off to keep their COBRA coverage in place, additional assistance from the federal government, assistance to the states so that those Americans who have Medicaid coverage continue to have those vital services provided. Because the worst of all world is in this time of economic downturn, not only to have people lose jobs, but to lose health care in addition to their jobs. So there is a big attempt to stabilize their markets. The President and I believe that health care reform has to focus on a couple of basic principles. Reduce cost for everybody, those who have coverage and certainly those who are struggling to pay out-of-pocket expenses. Provide choice to Americans. People who like the coverage they have should continue to have it, as the President has made clear, but those who are in a difficult situation should have a choice of doctors and providers, should continue to move along, making sure that we shift the system, that we don't just keep doing the same things that we know don't work very well, shift toward prevention and wellness, shift toward rewarding primary care providers and preventive care and first-line responders, making sure that we don't continue to pay extra dollars for a sickness system, but we begin to put incentives for a wellness system, knowing in the long run that has huge payoffs and benefits. And finally, that we've got to cover all Americans. It is unacceptable in this country to have almost 50 million people without health insurance. And finally, what we know is if health care reform is to be a reality, we need you at the front line. Nurses have always been the strongest and clearest advocates for health reform, year in and year out. It's been my experience at the state level. It's been my experience watching at the national level. We do have a website, www.healthreform.gov, www.healthreform.gov. Come on the website. Join the effort. Sign the Health Care Reform Pledge. Take the daily health quiz. Some of you might even be surprised by some of the answers. We are engaging and involving people. We've got information on Facebook. We're Twittering. We're communicating with all kinds of folks. We've got a widget on our website that you can put on your website and drive people to the healthreform.gov website. We need to mobilize an army across the country, and I want nurses at the head of that army. So help us, join us. President Obama thanks you for the work you're doing. I thank you and look forward to working with you. Thank you very much.